Hi everyone, my name is Grace. Today we're going to be talking about HIV. HIV is the global health issue. And since 1983, we have 88.4 million of people who have been infected with 42.3 million of deaths. Furthermore, since our work we're going to be in Africa, all data reported that 25.6 million of people were living with HIV in Africa in 2021. Principally in South Africa, we have a 30.2% with a 32.9% among key identified men. Our target population face principally different barriers as poverty, lack of transportation, education, and so on and so on. Our problem statement include barriers to accessing and using in prevention services among men of color who have sex with men in South Africa contribute to the persistently high rate of new HIV infection. Our contributing factor include social, economical, and educational factors. Social economical factors, since our target population comes from lower income community and they do not have access to healthcare services. If they have access to healthcare services, they need to pay transportation, a lot of fee for the transportation, or for the copay, if the insurance post for them, and to afford to pay for those treatment or drugs. The educational factor is depend the level of that person education, so they can know how to prevent themselves to not get the HIV, as well as how what kind of services they need when they get it. The educational factor to determine their incomes. That is why I say social economical factor associated with educational factor. Also, our target population face what we call stigma and discrimination from the family members, healthcare providers, and partners. That is why this negative environment discourage them principally to seek for treatment or testing their self, disclosing their self in the that is, so our intervention principally aim to help in that on that issue, as well as to help UNI to achieve their goal. Our intervention consists mainly in three approaches. The first one is to create what we call advertising campaign, where we're gonna be putting the question and an adequate image. The question could be, if you were rejected every time, will you disclose yourself? Anybody they're gonna ask that question to, who gonna read that question, can start the discussion in their community or with their colleague or co-worker, with their partners. So we need to start by self-awareness about the situation. The second step are gonna be creating educational materials. To create that educational materials, we're gonna start by focus group, having focus with interview so we're gonna know our population need. The educational materials gonna be related with our community need. We're gonna evaluate during those focus group and interview what the community already know and what they need to know. Our third approach is to create the website. The website where we're gonna have facilitators or who gonna create the safety environment for individuals to share their experiences with, to discuss topics related to stigma, and we're gonna put educational materials on that website. Our sustainable development goal is the goal 3, health and well-being, good health and well-being, which name to ensure that we name to ensure healthy life, promotes well-being for all individuals and all age. Our culture adaptation. Since stigma is the sensible topic, we name that to understand diverse beliefs around sexuality, health, and morality in different culture is essential to avoid increased stigma or put it worse to our target population. The second one gonna be like our educational materials have to be in different languages, and also the quality of the writing we have to put on access to anyone with different and level of education can have access to those educational materials, those content, and understand it, what we mean. And also we have to address any kind of misconception of myths around HIV. And lastly, engage with the community members as influencers so we can build trust and acceptance. The interprofessional team we're going to be working with is the health communication specialist. Its role is vital since we have to raise our awareness and stimulate communication about HIV stigma during our advertising campaign. So they're going to be the one creating any image in our educational materials as well as during the campaign. And the community health worker going to be the one discriminating those promotion materials, engaging with community members, as well as allow that educational material get to the target community or the target population. The public health educator gonna be the one training our healthcare professional and community leaders. Second, they're gonna be the one realizing the focus group of discussion on and writing down our educational material contents. All of this need money or funding. That is why we need what we call a global funding to aid, global funding to fight AIDS and tuberculosis and malaria. This organization assists in funding and resources is for our intervention on they're gonna allow us that our intervention to be sustainable, or the UNI, since we are helping them to reach their goal, they're gonna distribute our educational materials on their network so we can reach more people, more target population for us. The South African nation Aid Consulting gonna be the one we're gonna be using in South Africa, since they know already the culture, they already have their network, and the populations can already trust in them. So we can use that organization to adapt our intervention onto it. The evaluation not gonna be principally, we're gonna asking two questions on does the intervention produce reduction of stigma? We can realize survey, we can realize survey focus group to have qualitative data, qualitative and quantitative data. The other evaluation question gonna be, does our intervention provoke an increase of preventive healthcare services, principally with the target on our focus population or target population on the impact of this presentation on anybody who gonna listen to this who gonna read the post. We want to influence their personal and professional value. So we want to increase the awareness around what is going on, how our target population are suffering, and they can address the topic with more empathy and sensibility. On the professional level, we want them to advocate for better health for our target population or health equity for our target population. Thank you.